them each briefly, and then bring them up to get their award. So I first came to know Rita over a year ago when Governor Deval Patrick approached us and said he wanted to do a town hall meeting with healthcare providers to present Health Reform 2.0 and get people's input on what he was working on. So it turned out we had only a few weeks to put together the event, and Rita was really the driving force behind really spearheading the effort that started with a couple of people and really ultimately grew to 20 or 30 people who were all working as a team on various parts of making this event a success. For all the doctors in the room, it's hard to argue that there's anybody who's more busy than an 80-hour-week intern, and Rita did this as an intern. So. Umbereen, this year as a busy hospitalist who's taking care of patients and trying to figure out where her next steps are, spearheaded a town hall with the Surgeon General, where she was presenting on the new national prevention strategy and trying to get healthcare providers to really be leaders in transforming our system to be one that focuses more on health and health promotion. And I get emails at all hours from Umbereen on all aspects of this, and she also brought together a whole team of people who could all feel like they had ownership and felt responsibility for this event. Both Rita and Umbereen, besides doing these big events, have spent so many hours talking to other doctors and medical students in Massachusetts, doing one-on-one conversations, emails, phone calls, trying to do things like email banking the other people in the state, and really just trying to build something in Massachusetts, and have brought together a core group of leaders, many of whom are actually here, to really push forward health reform in this entire cause in the state. So, through the glamorous and the unglamorous work of organizing, they have both been just inspirational leaders and hopefully inspiring to the other people in this room who may be new to organizing. It's something that you can do as a busy doctor, as a busy intern, and something that hopefully maybe somebody else in this room will be getting this award next year. So, without further ado, I'd like to call up to the stage Rita, Nguyen, and Umbereen Nehal. In recognition of your tireless advocacy for a system where everyone has affordable, high-quality health care.
I actually just recently attended a different conference on leadership just yesterday, and one of the ways leadership was defined was you don't necessarily have to start something yourself, but seeing an opportunity and stepping up and taking responsibility. So I think that we would both probably characterize it that way. And, we're part of a much bigger team, and so we're representing pretty much all of Massachusetts by accepting this award. There have been countless people who have helped along the way, specifically Sonia, who was my co-organizer for the Surgeon General event, and was phenomenal the day of, because actually the day that the event happened was the first day EMR was rolled out at the community hospital. And I was a little nervous about whether I'd actually make the event that I was supposed to moderate. But all turned out well. And I think at the end of the day, it's about kind of rolling with it and just stepping up when you see a need. And I couldn't do it without the network of folks, everybody here, and just the inspiration you guys provide. Thank you.
For this honor and for recognizing the work that we do, but that we all do in this room to push things forward with healthcare reform. I want to thank DFA in particular for this last year. It's just been incredible. I felt like I finally found an avenue for the things I cared about and the passions I felt, whereas before it was just frustrations of a medical student as a resident. I actually felt like I lot of skills, had a lot of experiences, and met incredible people through the experiences I've had with DFA. For that, I'm incredibly thankful for how rewarding this past year has been for me. And I was actually just speaking with a new friend I just met at my table about something I wanted to say to the audience as well, that I have a corner table in the back, so I can sort of get a view of everyone in the room. And something that's just really inspiring for me is to see the practitioners in the room. In Boston, a lot of what DFA Massachusetts for us now, visually, as we get together as a group, it's very young. We're medical students, we're residents, we're newly practicing physicians. And it's just amazing to me to see some of you all out there who've been in practice for decades, and that you come to this conference, and that you care about this, and that you fight the same fight. And I know that that's the case, but it's just great to see that. So I just want to thank you all for the inspiration that you give us.
All right. Just a couple of other announcements. Maryland and DC folks, you're having a huddle in the state room over there. So you can go ahead and head over there until the next session, which is at 1:15. Again, we did move, for those of you who may have come late, we did move switch the 2:45 session and the 1:15 session. So we're doing the breakouts later. We're doing the listening session at 1:15 in this room. And there are sign-up sheets out in the lobby for dinner. So you can just sign up for, these are restaurants that were chosen by our Yelp Elite National Campaign Director over there, Samantha. So they're good restaurants, they're great places around this area, great opportunity to get to know everybody. And there's one more announcement I was wanting to make. The campaign. For those of you who have not signed up for the 1 million campaign, definitely sign up. This is your opportunity to go out there, educate everybody about the Affordable Care Act, move everything forward as a physician leader in your community, and this is your entry point to go on the bus tour from Tampa to Charlotte with us. So sign up. And I'm getting motion by board member Mona over there. Everyone has a cell phone, and you see some signs around the room. Doctors for America is possible because of the passions of everybody who's come here and everyone who was not able to make it to this conference. And it's also possible because of financial support. So, if you are able to, take out your cell phones and text 72727, text DFA, and it will ask you for your pledge, and then you can complete your pledge, and it really helps support this movement that is possible because of all of you and all of the resources that we can bring together in the community. That's it. See you at 1:15.
Why don't you take a picture?